Hello students, this is a how-to tutorial provided for medication administration via gastrostomy tube by Gravity. Things that you need to consider are to be sure to take steps to ensure patient privacy when performing the procedure. The fact that the most significant risk with giving liquids via gastrostomy tube is possible aspiration into the lungs. Be sure the patient is positioned properly with their head elevated at least 30 degrees. And encourage the patient to assist in the procedure if possible, as much as they are able to help, and this way they can learn self-care skills. Procedure for medication administration. Check for authorization forms or any record forms that the patient may have. Review the medication administration form, the medical provider form, and the parent or guardian consent form. The 5 rights. These are the 5 rights that you need to check before doing anything. Make sure that it is the right patient, the correct time, the medicine container matches the authorization forms and medication administration record, the dose on the medication container matches the authorization form and records, and that the medication is in the correct route as identified on medication container, authorization forms, and medication record. Here are some steps to follow. Explain the procedure to the patient at his or her level of understanding. Wash your hands. Gather the equipment and place it on a clean surface. And make sure that you position your patient either sitting or supine with their head up at least the 30 degrees. Aspiration to the lungs. The most significant risk with giving liquids via a gastrostomy tube is possible aspiration into the lungs. That is why it is very important to position your patient in the right positioning. Be sure that they are positioned with their head elevated at least the 30 degrees. Next, you need to put on your gloves. Put a towel or washcloth under the patient's gastrostomy tube. And then observe their abdomen for signs of malposition or obstruction of G-tube, such as difference in external tube length compared to their baseline measurements, or if they have any abdominal distension. Comparing tube length measurements. Compare the external tube length to the tube length measurements obtained after the initial placement of the tube. Contact parents or their guardian and the healthcare provider if there is a discrepancy in their measurements. If the patient has abdominal distension, do not administer the medication. Instead, go ahead and contact their parent or guardian and the healthcare provider. Next, you need to fill the extension tubing with water using a syringe with at least 5 cc or 5 milliliters of water. This way you aren't getting air into the tubing, which can be bad for the stomach. Next, you need to remove the plunger from the syringe, open the port on the gastrostomy access port, attach the extension tube filled with water to the access port, then attach the syringe to the medication port on the extension tube, and pour the prescribed medication amount into the syringe. Next, you need to elevate the syringe above the level of the stomach. Open the clamp on the extension tubing and allow the medication to slowly flow through the extension tubing. You don't want it to go fast because that can upset the stomach. Next, clamp the internal tube and remove the syringe. Remove the extension tubing and replace the plug on the gastrostomy tube. Make sure that the medication is secured, and then wash the syringe and extension tubing with soap and warm water and put it in the correct container that it belongs. Check to see how long you can reuse any of the equipment. Some of it you might be able to use longer than others, so it's good to know this information. Then remove your gloves and wash your hands. Then one of the most important steps is to document your medication administration on the medication administration record form. Follow up with the parents or guardian and the healthcare provider as needed. Here's an example of a daily log for medication administration for a student. They do look different in a facility versus a school, like so at a nursing home or home health setting. All the MARs are going to look different, but they're going to have the same information on it. So the school one, you want to make sure you have the school year, the name of the student with their date of birth, which school they are attending, and then for this one, it's an individual MAR, so what medication are they taking and what's the dosage and the route that the medication is supposed to be given through. Here's an example. So with the syringe, you would put the medication in there, hold it above the stomach, and this is the tube extension that goes into the G-tube. Hope you guys learned a lot. Thanks.